One of the most common surgeries that we perform is to repair the cranial cruciate ligament in the dog.
And the cranial cruciate ligament is similar to an ACL in people. It helps to stabilize the knee and keep it from having movement during a regular walking or running motion.
In the human knee, the femur rests on a flat tibial plateau. The dog knee, however, has a very fundamental difference, and that is there is a slope to this bone, or an incline, of 20 to 30 degrees. It's the cranial cruciate ligament inside the knee that acts like a rope that prevents the femur from sliding backwards.
What happens when the CCL ruptures is that the tibia will move forward and relative to the femur, and that little instability, that movement causes pain and discomfort. So one of the things we always do when we do knee surgery for a torn cruciate ligament, be it a TPLO or an MRIT, is we always evaluate the inside of the joint, including the meniscus.
If we lift the femur off and we take a skyline view of the tibial plateau, the meniscal cartilages are shaped like boomerangs. The outer meniscus is attached to the femur, so as the femur slides backwards, that outer cartilage moves with the femur and rarely, if ever, tears. The inner meniscus, however, is the problem child, because the inner meniscus is attached to the tibia with a small ligament and is fixed in position. So when the femur slides backwards, it will go over the back portion of this cartilage or meniscus like a steamroller, and many times the back portion of this cartilage will tear. So when we are in the knee, it's very important to identify this tear and remove any torn cartilage. This cartilage will regrow in 6 to 9 months in the dog. If, however, we find that the cartilage is intact and not torn, we will cut that little ligament to perform what we call a meniscal release and allow the meniscus to get out of harm's way.
Essentially, if the meniscus is not addressed in some way, shape, or form, you can have a dog that recovers well initially, then develops a late meniscus tear and becomes lame again, and we try to avoid that whenever we can.
Following exploring the knee, we then need to perform a technique that will stabilize your dog's knee. In smaller breed dogs, typically dogs less than 30 to 40 pounds, one of the most common techniques we will perform is what we call an MIRT, or modified retinacular imbrication technique.
And the MIRT is essentially the placement of a nylon suture to mimic the action of the ACL or CCL. The way we place this is it is looped around the fibula, which is just a little tiny bone at the back of the femur, and then also through a pre-drilled hole in the tibia.
This monofilament nylon is then tightened around the knee, and it is passed in the direction to mimic the original direction of the cranial cruciate ligament. With this monofilament nylon in place, the body reacts to the suture and lays down layers and layers of scar tissue on top of this monofilament nylon over a 12-week period. It is the scar tissue that is laid down that provides ultimate stability of the knee. Following performing the MIRT, it is very important that you keep your dog extremely quiet for the first 12 weeks after surgery. No off-leash activity outside and in the house, preventing jumping and anything that could potentially cause rupture of the monofilament nylon. It takes approximately 12 weeks for the scar tissue to form. Expect some swelling and bruising of the limb. If there is any discharge at all from the incision, you need to let your veterinarian know. Following the 1-week recheck, you will then be able to start actively leash walking your dog, starting with 15 to 20 minutes a day and increasing by 5 to 10 minutes per week. You'll then return for reevaluation with your veterinarian approximately at a month, 8 weeks, and then at 12 weeks. Following the 12-week recheck, as long as your dog is doing well and the lameness should have ceased at that point, you can start returning your dog to normal activity level.